primarily a print journalist. I tell most of my stories in text. I got a chance to collaborate with an amazing filmmaker, but sometimes you do not get to really comprehend or carry your readers vicariously with you. And I think this is where visuals really come in.
Visual storytelling for me as a cinematographer and director is a very important part in storytelling, and for this case, very important for health journalism. It interprets what's on the ground and you're able to see it in real form. Our film with Lilies Njeru is titled Birthing Stool. It's a film that explores the maternal practices and the birthing practices in north of Kenya, around Turkana women in Turkana County.
So it's really important to show what is working when it comes to the various health issues that many people are going through.
It's not a story we would get anywhere else around. So by being matched with her and collaborating with her, I was opened to this world whereby I was able to give a story in the most remote place in Kenya, which is Birthing Stool.
When you speak to the communities where that solution is happening, you realize just how it's a lifeline to them, really. And that is why we felt that we really needed to go to this community and see how they live, how this birthing stool is shaping their lives.
I found that whatever the story you're doing, it helps to bring it all together in a multi-form, but most importantly, in video format. And I do not say that writing the story is not important or doesn't do the job, but I am saying when we engage a multimedia approach, then we get better achieved, and even in a short while.
From the workshop, which literally prepared us for the journey that was ahead of us. And we saw on the field how this was very beneficial to us. So there were literally things that our facilitators back then, they told us. And we saw, we experienced it ourselves. My understanding of what storytelling is you write a story. But this time around, there is a new perspective that this fellowship has brought, and getting to work with a partner who is a filmmaker already, there was quite a lot that I learned throughout the journey.
I do not have the permission to give up on myself, because there is this entity somewhere who's taking it all. And, the never give up attitude that went into this whole organizing us telling this story has been life-changing for me. 2 million women across the world suffer from obstetric fistula, a pregnancy-related illness that causes women to urinate unawares.
My one-word short talk is about vesicovaginal fistula, which is a disease that affects women mostly in the northern parts of the country.
And interestingly, this was a condition that had solutions, but many just didn't know. I found that Solutions' approach to telling health journalism stories is quite important, because it doesn't just bring us to the knowledge of the problem, it equally takes us to what is possible. I feel that beyond even our own comprehension, this has gone on to set free a lot of women, not just in Nigeria, possibly across Africa.
It was so important that I learned about telling stories using my phone, that I actually do not have to start learning from a camera, because that can be hard. It can take a long time, but then just knowing some few features in my phone, I could use it to tell stories.
I had never actually shot like a full documentary with a mobile device, and I was actually able to do that. After learning with a facilitator, I was really passionate about actually practicing it.
I feel in this perspective it has really helped us to tell this story better.
Our film is about the cold chain supply of vaccinations to unreached communities.
And how they are helping communities like the Maasai and the Fulanis, who are nomadic pastoralists, to access vaccines.
My collaboration on the program was actually like a cross-country collaboration, if you call it that, because my partner, Teresa Michelle, was in Kenya and I was in Nigeria, and we had to produce a film together.
As a print journalist, I'm not actually left out in filmmaking, because I could bring a lot of perspective in how the story is actually told.
For solutions to be optimized, we need to talk about them. And film gives us an avenue to lead and generate those conversations.